Welcome to a guide to COVID-19 health module. My name is Cindy Crossman, and I'm the registered nurse educator at Mount Allison University in the Wellness Center. And today I'll be narrating this module. First of all, the goal of the presentation is for folks to understand what COVID-19 is, how to prevent any symptoms of it, how to recognize if you have any symptoms, and know how to get tested if you need be, and process around COVID-19. So let's start by what is it? COVID-19, or the coronavirus, as folks call it, is a respiratory illness. It's a virus, and it can range from mild to severe. And as you've been listening and following along with all the pandemics since it started, some cases can result in death. Symptoms can show up to 2 to 14 days after you've been exposed to the virus, and everyone is at risk of getting it, but the higher risk population are the older folks and those with compromised immune conditions. So obviously, how is it spread? It really is spread contact with infected person or a surface. So droplets from an infected person's nose or mouth that are released when they cough or sneeze or exhale, or even frequently touch surfaces that could be contaminated, and then not washing your hands and touching your hands to your eyes, nose, and mouth can actually expose you to it as well. Think about people, they're kind of human folks that pass this virus from person to person. So let's talk a little bit about the symptoms of COVID-19. So when we first heard about the COVID-19 virus, we heard 3 common symptoms. If you have them, you better get tested. And those were consistently fever. So you have to take your temperature to know if you have a fever. And that means an elevated temperature of over 38 degrees Celsius. A cough, and that would mean a cough that is a new onset of a cough, or a cough that has exacerbated or gotten worse in the last few days, and shortness of breath. So those were the 3 classic symptoms. Now, public health has expanded the list to include all of these symptoms. So the fever that's elevated, the temperature over 38, the cough, onset of new or worsened cough, shortness of breath, where they've added sore throat, runny nose, a headache, new onset of fatigue, a new onset of muscle pain, diarrhea, loss of a sense of taste, loss of a sense of smell, and in children, purple markings on their fingers and their toes. What the literature is saying now, if you have 1 or 2 of these symptoms, we need to be looking and see if we have those, as we might need to take up into the next step of what we do if we do have any of those symptoms. Obviously, we want to do everything we can to protect ourselves and others, which is key from getting any symptoms. So frequently wash your hands with soap and water. If you can't have access to soap and water, then certainly you can use an alcohol-based hand sanitizer. That will work as well. Not as good as the good old soap and water and hand washing, but it will do in a pinch for sure. Better than nothing. Avoid touching your eyes, nose, and mouth. So we don't want to bring any of those contaminated things we've come into contact with to our eyes, nose, and mouth. Practice coughing etiquette. So not coughing in the palm of our hands, coughing in the folds of our elbows, for example. Stay at home as often as possible, and especially if you're feeling unwell. Clean and disinfect frequently touched objects and surfaces within your home. Practice social distancing by maintaining a 2 meters or 6 feet from others when outside of the family unit home. And now public health has strongly recommended that public wear a non-medical mask or a material community face mask when outside the home or in the community. So for example, the masks are not going to take the place of social distancing and hand washing. But if you can't maintain those other measures and you're going out, say to the grocery store, you can't control if someone comes within 6 feet of you. So obviously you're wearing that facial covering for the protection of others when you're out. So for those vulnerable populations that we previously talked about. And really, the most important thing I want to say is get your information from trusted sources. So your World Health Organization, public health, government websites, those are where you want to be getting accurate information from about COVID-19. First line of defense, I just want to reinforce is about that hand washing. So I did say with soapy water, we want to wash our hands. And the important thing is we should be doing that for at least 2 minutes. And process is, I know it's pretty simple, everyone washes their hands, but it really should be turning the tap on and wetting our hands really well, putting some soap on, make sure you get some soap and scrub around. So we're rubbing the palms together, we're washing the backs of our hands, scrubbing those together in between our fingers and our nail bed. So we're making sure we're having a really good scrub there. And so that we can get rid of anything we've come in contact with. Obviously rinse with the water and make sure to dry either with a blowing device or with paper towels. It's really important to have those dry and pat it dry when you're finished. And to ensure the 2 minutes, lots of literature out there is saying, sing a song, happy birthday song a couple times will take you 2 minutes. So whatever it takes to make you do that, that's the process that will work for hand washing. Then the other thing we talked a lot about, the two main things, hand washing and social distancing. And lots of folks will say, does that really make a difference? Absolutely, it does. You should be practicing social distancing right now. Even if you could feel completely healthy, the key is you want to maintain healthy and you don't want to come in contact with anyone that may have the virus. And then you don't want to spread that to someone else. So to lessen the burden on our healthcare system and to ultimately reduce deaths or illnesses to those vulnerable populations, we want to be practicing social distancing as much as possible when we're outside our home. Then we've moved on a little forward. If we can't get our hand washing done right away and we can't maintain that social distancing when we are out in public, since they're lessening some restrictions so we can go out in public and go to our grocery stores or go to the pharmacies, we can be using a community face mask. A community face mask, just for clarification, is not a N95 mask, it's not a medical mask, it's not a surgical mask, it's not the same mask that healthcare workers are using. A community face mask is made of a material and it's a facial covering, so it has to cover your nose and your mouth because we talked about how the nose and mouth, and those are the secretion areas that we don't want ours to come in contact with someone else's. So wearing that mask is a protection for other people. So a good guide about face wash masks. So if I need to go to the grocery store and some people have disposable ones that you can use, so you're using it for one-time use. But if you're using this community face mask made of material, then you're going to need to launder it and you're going to need to care for it. So before I go, I'm going to make sure I wash my hands, put on my masks. It's going to cover my nose. It's going to cover my mouth. There's no gaps in those areas. If by chance I'm out for a longer period of time and it's damp or wet inside, they're saying that should be used for one single use only, which means you'd have to take that off and put another mask on if you're going, or if you're finished and it's wet and moist, make sure. I often take a baggie and put it in my car and put the contaminated wet one in a baggie, and then I can launder it when I go home because I want to reuse it. Otherwise, if it's disposable, then I'm removing that mask and I'm disposing it in a garbage can properly. The other thing is when I remove my mask, I make sure that I'm not touching the front face of my mask. I'm taking it off over my ears, whether it be ties or elastic, but that's how I'm taking it off. Dr. Jennifer Russell, the medical officer of health in New Brunswick, did a wonderful video about facial mask coverings and actually does a demo on how to put it on and take it off and what it looks like, and that you can YouTube that on the website, and there'll be a link attached to this YouTube video at the end in the description section. But make sure to watch that. It's very informative and very insightful. So the next thing I want to talk to you a little bit about is three different terms we're hearing a lot about COVID-19. We hear a lot about on the news, self-monitoring, self-isolation, and isolation for COVID-19. And, some people use them interchangeable, but they're very different. I just want to explain to you that everybody should be self-monitoring. Everybody should be monitoring their symptoms. So if you don't have any symptoms, but have a history of a possible exposure, you want to make sure you're monitoring your temperature, you're paying attention to see if you have any of those symptoms. The next one is self-isolation. So you could have no symptoms, but have a history of maybe a possible exposure to someone who had the coronavirus due to travel for example, or in close contact with a person who was recently diagnosed, and you didn't know at the time, then you would need to self-isolate for 14 days. And again, self-monitor to see if you have any symptoms that do start. The last one I want to talk about is isolation. So this is the one where you actually have those symptoms that we talked about, even if they're mild symptoms. So if it's a mild sore throat, if it's a runny nose, if you have those, then you definitely want to isolate yourself for 14 days. You may have even gone to the next step and got tested and you're waiting for those results. Absolutely, you still need to isolate yourself for the 14 days to see what the results are going to be. And then obviously, if you are diagnosed, you're going to isolate. So those are the three kind of steps and stages of processions. So protecting others and watching and doing protocols according to public health around COVID-19. So people are saying self-isolate. When again should I do that? When you're diagnosed, for sure. When you're waiting to hear the results. When you're told by public health that you might have been exposed. So for example, if you were on a flight somewhere and you're feeling perfectly fine, but you get a call and says from public health and says you were on flight XYZ and someone has tested positive, you need to self-isolate and watch yourself for 14 days and monitor. So you really would have to self-isolate in that instant. Or if you travel outside the province or for the last 14 days, you need to self-isolate, or you have a couple of the symptoms, you should do that. You're protecting others at that time. What do you do if you believe that you actually have some of those symptoms? So it could be back here in Sackville, and obviously you have a couple of those symptoms and wondering what you should do. First thing, stay home. Stay home and make that call to 811. We have a system in New Brunswick that if you have symptoms, one or more of those symptoms, that you call 811, you talk with an operator, tells you the best way where you can get tested. There's certain testing COVID sites, would recommend where you go to get tested and the process for that. However, I do want to say if you are having difficulty breathing or experiencing severe symptoms, not mild ones, then you should call 911 immediately. Now, lots of people will be calling that 811 if they have a couple of those symptoms, and sometimes they get backed up. So what other alternative are there out there if you are showing symptoms? What should you do? Again, stay home, and you could take a self-assessment. So I'm going to talk to you about a couple of self-assessment tools. The first one is a New Brunswick self-assessment tools put out by Public Health. And this tool walks you through a self-assessment. So it's asking you if you're having this symptom, check it. If you're having this symptom, check it. If you're doing this, what level of severity of that symptom. And it's telling you, oh, you can stay home and monitor this. You need to report here. You need to do this. So it's an algorithm that tells you what to do. In case there's long waits for that 811, this is a great resource for people. The link is in the description again, but obviously it's a New Brunswick self-assessment tool for COVID-19 as well, would bring you right to it. The other self-assessment tool that I wanted to bring to your attention is a Government of Canada self-assessment tool. Same principle, Government of Canada, it's going to ask you what province you're from. It's going to walk you through, not feeling well, what do I do next? Are my symptoms severe? Are they mild? What are my symptoms? It's going to ask you those questions and then direct you at the end what you should do. Again, the link will be in the description, but it's Government of Canada self-assessment COVID-19 tools. These are great tools, especially if you're not feeling well or having a couple symptoms and you don't really know what to do. Stay at home and go through this process and it will guide you. So you've done those things. You've gone. 811 has directed you to go to a COVID-19 assessment center, and you've had that assessment completed, and now you're waiting for your test results. So sometimes it's difficult to get those results. So what's happened in New Brunswick is we have a register for My Health New Brunswick account. So you go online, register for that My Health NB, and using your Medicare, which is your provincial health card number, and a registration code that you set up, then you actually can get your results via the computer when they're available. And it's a very good tool that way, and then it will advise you if you're having mild symptoms, then obviously you're going to continue to monitor those, and they'll advise you about care around those. But definitely you want to get your results, so then you need to know if you have to isolate for the 14 days. Other virtual resources that I wanted to bring to your attention is, what if you're not really having those kind of symptoms that we talked about, but you're just feeling unwell and not sure? You think, oh, that's not valid enough to go through to call 811, and it's really not fitting for COVID-19 self-assessments. Other virtual resources available to you in New Brunswick. This one I want to mention is called eVisit New Brunswick. It's free to anyone located in New Brunswick about any health condition or symptom out there except for travel health and diabetes. You book online and it's covered under your Medicare number. This way you get to select the physician. There's various physicians that you can have a virtual consultation with. They'll do an assessment and provide a treatment as needed. Another type of virtual visit available to us is Canada-wide. It's open 7 days a week from 7 to 9, and you really register here. It's called app.getmaple.ca, and this is set up through an account through a Shoppers Drug Mart is how it started, and again it's an appointment with a virtual physician, and I believe there is an appointment fee to that service. But again, if you're looking for medication management, or should I be taking this medication if I'm feeling this well, it's a way to have a consult with a physician without going outside your home. So those are great tools to be aware of. And most importantly about this presentation, I just would like to say it's really important that folks stay informed and learn how we can work together to help keep New Brunswickers safe and prevent the spread of COVID-19. World Health Organization and Government of New Brunswick, both, if you Google both of those, they will keep you apprised of what's happening and what level of restrictions are being released in New Brunswick and where we're at the stage of this pandemic. So you can Google those, or the links are also in the descriptions. For inquiries at Mount IA specifically about COVID-19, we have an email account set up and a COVID-19 response team. So the email is covid19@mta.ca. You can send queries or concerns that way as well. And finally, I'd just like to say stay well and stay safe, and thank you very much.